Welcome to the MamasteFit podcast. In this episode, we're going to be chatting with Dr. Addie Holzmann, pelvic physical therapist located near us here in Southern Pines, North Carolina, all about how you can adjust your workouts to train with your cycle. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And this is Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable. Pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experiences as mothers navigating the stage of lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you've chosen us to support you. Welcome to the MamasteFit podcast. In this episode, we're going to be chatting with Dr. Addie Holzmann, who's a pelvic physical therapist, all about how you can train with your cycle. When it comes to training with your cycle, we're not necessarily going to be completely omitting exercises or completely modifying our workout routine. Rather, we want to recognize that different points within our cycle, our recovery needs may change. So we may have a harder time recovering at certain points. We may have an easier time recovering. And so that's really going to change your workout intensity. So you can still do the same type of workouts throughout your entire cycle, but we may need to adjust the intensity to accommodate for our recovery needs. So let's go ahead and get into it. Welcome to the podcast, Addie.
Thank you. It's so fun to be here.
Can you share more about yourself and what has motivated you to learn so much about training with your cycle?
Yes, I specialize in pelvic floor and primarily with female athletes. So after I was done having kids and figuring out my cycle again, I came across Stacy Sims, the book Roar, which I highly recommend for any female athlete. It just has a lot of good information about training with your cycle and just laying the foundation for that. And then I took her course and I was just completely intrigued. Why haven't I heard about any of this prior, right? This is stuff we should be getting in sex ed, just understanding your cycle, what the hormones do, how they affect your body, especially getting into sports when you're, young. So anyway, took her course and I fell in love with it. And I've just been, when was that? That was a couple of years ago. So the last 2 or 3 years, I've just been working with that and also teaching clients how to track their cycle, work with it. Because as a pelvic floor PT, I also see some patterns with pelvic floor symptoms with the cycle. And so hormones can sometimes explain that.
Well, I'm really excited to chat all about working out with your menstrual cycle and recognizing that a lot of research that has been done on exercise and fitness have been done with male participants. So a lot of the recommendations that we have with exercise in general is for men. They're not typically for the female athlete. And looking back on my college years, if I had known this information back then, I would have been so much better of an athlete in college. I would have been a much better high school athlete. I think the recommendation that most of us got when we were in college was just go on birth control so you don't have to worry about your menstrual cycle. Just make it go away so that we can just train you like everyone else. And whenever I was not on birth control, I found that I was performing a lot better. So could you talk about how we can train with our cycle?
Yeah, so I just want to put this out there that there isn't a ton of solid research to support cycle training, but I tell everyone, that makes it even more important to learn your own cycle, your own tendencies and patterns, because, learning your body, there's only good that can come from that. So this is geared towards a natural cycle, so not on any hormonal birth control or the IUD non-hormonal. So the copper IUD you should have fairly normal hormone levels with that. So there's a different shift that you would do if you were on hormonal contraception, but you have from the start of your period to ovulation is your follicular phase. And so this is the phase that typically if hormone levels are good and healthy, you can go harder, more intensity, your recovery time is quicker. So you might be able to train harder more frequently than the second half of the cycle. Your oxygen consumption is more efficient. There's just all these cool things about the follicular phase. But then in the second half, I feel like there's this myth of like, oh, you can only do this at this part. And I'm like, that's not the point. The point is, right? Like your hormones are like, ebb and flowing, and you're just trying to maximize whatever hormone is the key player at that time. So estrogen peaks during ovulation, and estrogen we need for muscle building. So this is really important before you hit perimenopause and menopause to really take advantage of estrogen, because once we hit that phase in life, it depletes and we're not getting as much. And so muscle building becomes really difficult. So lifting heavier, really putting on the resistance is really important. But, PRs might be a little bit easier to hit around ovulation. The catch-22 is that estrogen increases connective tissue laxity. So this is where like ACL tears, things like that can be a problem. So making sure you have a really good warm-up if you are going to do a really heavy day and go for a PR, but taking advantage of that estrogen around ovulation is huge. And then in the second half, which is the luteal phase, so this is from ovulation to the end or right before your period starts, there's a lot of changes in our body. Our thermal regulation isn't as great, so we tend to get really hot. Our sweat response is delayed. We have a little bit more inflammation in our body. So like these things can affect our performance. So it's not like don't work out for half the month. That's not the point. But the intensities might be a little harder to hit. So thinking more volume, like going lower weight, higher reps, think endurance things. So like if you're doing higher weight, lower reps, more intensity in the front half of the cycle, you would do more volume training in the second half and just kind of think like long and slow versus quick and heavy. And then like right before your period hits is usually when we feel kind of meh. And so doing more skill work, maybe technique work, and just not really worrying, so much about the performance, but like dialing into mechanics. So that's a very broad overview.
So it sounds like the key things between each half of the cycle is the recovery time, because for our workouts, the portion of our workout that's helping us to improve our capabilities, our performance is the recovery. And so I know for myself, when I don't emphasize recovery and I don't emphasize nutrition in between my workouts, my next workout, I have a harder time hitting those weights or running as fast because I'm not recovered enough. And so that's what it sounds like to me is really the big difference between the two cycles is you can recover so much faster and more efficiently in the first half of the cycle versus the second half.
Yeah, that is a huge difference. And then that low energy availability is a key thing too, especially with athletes. Yes, physical performance, like as a PT, I'm thinking more like physical things, but nutrition is huge. And that's also going to affect like your hormone production, right? Because nutrition's the building block of everything in our body. So thinking of like, yes, really important to make sure that you're not like slumping into that low energy availability any point in your cycle. But your calorie uptake, like you do require a little bit more calories in the luteal phase too. So just like little tidbits. Yeah, there's a whole nutrition part of this too with like eating for your cycle, but I'm not a nutritionist.
So Roxanne, can you explain the general difference between the hormone cycle for a male versus for a female to kind of explain why training with our cycle might be beneficial?
So a male or someone who does not menstruate, typically their cycle of hormones is 24 hours. Like they have the same kind of hormone cycle every single day, and they don't like cycle through them where one day they wake up and they're like maybe just cry randomly, and then the next day they're like super, super happy. Whereas with us, with our menstrual cycles, our hormone levels are changing literally every single day. You never have the same amount of hormones. I mean, some people might like for a couple days, but it's like you're constantly changing the amount of hormones and the concentration of the different hormones in your body, where if you are trying to do certain physical activities that you're trying to improve in different aspects, it will be different what you're able to do every single day. Whereas with someone who does not menstruate, potentially they're able to do the same thing every single day and achieve better results.
Could you give an example of how someone could be programming their workouts throughout their month for, let's say, for somebody who has like a normal, quote unquote, like 28-day cycle?
So for cycle training, the first thing you're going to have to do is know your cycle. So you need to know how long it is, and you need to know when you ovulate. So 28 days is just a really easy number. Not everyone has a 28-day cycle, but you usually ovulate 2 weeks before your period hits. So give or take a few days. So if you have a longer cycle, like 35 plus days, you probably have a longer follicular phase, which good for you. You can train harder in that follicular phase. If you have a shorter cycle, you probably are going to have a shorter follicular phase, but you need to know when you ovulate. Ovulation is really important for like overall hormone health, but 1/3 of periods had no ovulation. So we can have periods without ovulating. And so if you don't ovulate, you don't get progesterone. So, and that is a huge important hormone for the luteal phase. So track your cycle. I love the Wild AI app, which is kind of associated a little bit with Stacey Sims, but it tells you like nutrition tips and workout tips for the day or the wherever you are at in your cycle. It's a period tracker. You can also track other things like your basal body temperature, your mood, all those other things that kind of help you target where, your energy is and how you're feeling. But some people, like in order to find where you ovulate, you can use LH strips. So they're like little strips you pee on, and you would start at around like day 7-ish, 7 to 9 of your period, and you want to test every day until it's positive. And then within 24 hours, you would ovulate. So that's also a good, because some people have like partial hysterectomies where like they don't have a uterus, but they still have ovaries. So they're ovulating, but they don't know because they don't have a period. So that would be a good way to know when you ovulate to help track your cycle.
So for me, I like to track my cycle by looking at my basal body temperature and then also cervical mucus. And so one way that you can do your basal body temperature is you just take a thermometer and you take your temperature every morning without moving. And that was a lot for me because I couldn't find my thermometer, and then I'd have to get up and then like my temperature would be all messed up. And so I started wearing like a watch that you would just wear overnight, and then it would actually track my resting heart rate so that I would know like, okay, my heart rate is like really elevated. I'm probably not recovering enough, or hey, it's staying pretty low. I'm recovering adequately. But it was just the Whoop watch, and there's so many different like watches that you can wear that will track your temperature to help you with that. And then for the cervical mucus, whenever I took a shower, I would just put my fingers in myself and I would assess the consistency of the cervical mucus. The LH strips I found really hard because I couldn't tell what was a positive because it's about how dark the strip is. And so there would be 2 lines, but they would be like slightly different colors. And so you're trying to compare the intensity of the 2 colors. And so it was just a lot for me. But some folks like swear by them. My personal preference is basal body temperature with the watch that I didn't have to get up and find and checking myself.
So if you are waking up in the middle of the night, or you're not like sleeping throughout the night, basal body temperature is not the most accurate way because you need to have like slept for a long period of time in order for that to be inaccurate, where it will tell you when you're ovulating. So if you are still breastfeeding at night or are just waking up in the middle of the night for like longer than a few seconds, it may not be the most accurate way to assess when you are ovulating by doing basal body temperatures. But doing cervical mucus and cervical position can be a great way if you are still like waking up in the middle of the night to assess for ovulation. With cervical positioning, when we are ovulating, our cervix is going to get a little shorter and softer to allow the sperm to get in easier. So your cervix position will be higher than normally when you're normally checking your cervical position. So that is one clue to tell you, oh, hey, I'm probably going to be ovulating, or I already have ovulated. And then with your cervical mucus, it's called spinbarky, where when you put it between your fingers and then pull it apart, it'll be like webby. It's similar to an egg white consistency. So if you notice both of those things, the likelihood that you probably are ovulating are high, especially if you like look at your basal body temperature and you're not waking up in the middle of the night. And that also correlates. Those 3 things would be really easy ways to tell when you're ovulating.
So for me, I usually feel more pelvic floor symptoms like heaviness or prolapse when I'm nearing ovulation or after ovulation. And then for the longest time, I told myself that I did not PMS. Like that was just not what I did. I wasn't like other girls. And for like a few days before my period, I would just be like irrationally upset and just a mean person. And I didn't understand why. And then I would get my period and I'd be like, I think I do PMS. So one day I finally admitted to my husband, I was like, So you know how I said I never did that? Well, apparently that's why I was such an asshole to you like a week before my cycle. But that's how I tell where I am in my cycle.
I think mine, I mean, it's been a while since I've had like a normal cycle with just being pregnant and breastfeeding and life. But I always knew that I was going to have my period soon, probably because I would just start to cry over the silliest things. Like, I know they always joke about the SPCA commercials, but I would cry. Like, I would watch the beginning of and I would bawl. And I was like, oh, I am weak, just weak. Emotional wreck. And then the next day my period would come and be like, just kidding. I am not a weak person. I just had a lot of hormones in my body. Cheers.
Let's take a break from this week's episode to talk about how I am using Needed to support my fertility. My husband and I are getting ready to plan our 4th baby. And so right now what I'm doing is I'm focusing on my trying to conceive preparation. And this is the first time that I have really focused super hard on preparing for my pregnancy. And it's really coming from having had pregnancy losses that were linked to some issues that I was having with my health, particularly my thyroid. And so I just found out with some more blood work that I did with my provider that I do have elevated antibodies for my thyroid again. And so I really want to make sure that I'm doing things to optimize my fertility before we start to conceive, because the elevated thyroid antibodies can be linked to recurrent miscarriage. At least it was for me. And so one of the things that I'm doing, and one of the ways that Needed is supporting me in managing my thyroid levels, is the first thing that I'm taking is their stress support, which is, I think some of my inflammation may be coming from just being really stressed out because I'm working a lot. And so I'm taking their stress support to help decrease my stress levels and to help me out as I am trying to conceive. In addition to other things that I'm taking that are not necessarily related directly with thyroid health, but going to be supporting my egg health, is going to be their egg support in addition to their COQ10, which are going to be 2 things that are going to help to optimize for my fertility. My husband is taking their men's line to help support his sperm health as we plan to conceive. And so there's a lot of stuff that they offer to help support your conception journey. They can support you throughout your pregnancy and even in the postpartum, even if you're not trying to plan to have another baby. I really love how intentional Needed is with developing their products, and I can trust that they have developed the best quality product for me to use during my conception journey, during my upcoming pregnancy, and then postpartum period. And so if you're interested in checking out Needed, head to their website at thisisneeded.com, and you can use code MamastePod to get 20% off your first order or first 3 months of subscription. So let's get back to what would a workout program look like with your cycle? So now we know how to find if we're ovulating. How should we be designing a program?
Circling back. So this is where things can get very individualized depending on like when your period hits. Are you more energized? Do you feel good? Or are you down and out for 4 days because it's heavy and crampy and all of that? So during those 4 days, or 4, I don't know why I said 4, however long your period is, usually the first couple when things are heavier, you can think gentle movement. I view it as like a waking up. Like usually I feel just crappy before, and then it hits and my energy is like kind of like coming back a little bit. If you're someone that your period hits and you feel fantastic, you can start getting into those higher intensity workouts as soon as you're ready. And then thinking of like the early follicular phase. So that would be more of like that waking up, getting things back as far as intensity. I like let's have running as an example. So in the follicular phase, running, you could do hills, right? Kind of strength workout, more intense. You could do interval training, more sprinty stuff, fast pace with like rest in between, versus like luteal phase where maybe you just go on a long, slow run where you're running more miles than you typically would, but it's very slow in that endurance piece. So think speed work in the front half, endurance work in the second half. You can also do things as far as weightlifting, like in the follicular phase, some ideas would be like power cleans. They're more intense, they're quick. Skill work. The follicular phase is a good period to learn new skills. So if you have a goal of doing a new exercise or learning a new lift, it would be a good period of time to start learning those skills in the follicular phase. And then ovulation is more of a like heavy lifting, and then getting into the luteal phase for more volume.
And so obviously you're not recommending like don't do anything during certain phases, like only do sprints first half and lift heavy weights in the first half, and the second half just exists until your period. We can acknowledge that recovery might be different between the two phases and kind of adapt to that as well. So if you want to have a very set workout design that's similar throughout the entire month, just acknowledge that, hey, I might need to emphasize recovery a little bit more the second half because I'm going to have a harder time recovering for the next workout, or maybe adjust the intensity level or the heaviness of certain lifts and get a little bit lighter the second half. So definitely not saying first half only do sprints, second half only go for long runs. Just understand that there's going to be a difference in your body and how you are responding to your workouts and how you're recovering.
Yeah, in a perfect world, that would be great, but we all have different constraints, right? Like stressors in life. If you're in a training program or you're an athlete and you have to do certain things at certain times, that's definitely a consideration. It's not as rigid. I would love it to be that simple, right? This is why women aren't studied very much, is there's a lot of factors involved in our cycle. Think of one person, that changes month to month, and then you try to study hundreds of women. It's a lot. So this is where you have to tap into you. But if you were to emphasize certain things, that would be what you could prioritize. So take a squat. If we're talking about a strength workout, let's say your period hits and you're feeling okay. So you do, you start doing some squat technique or whatever. And then maybe you get into squat jumps, right? That's intense. It's strengthening. Maybe ovulation time comes around and you're going to go heavy. So you're going to go really heavy, go towards those PRs. And then you hit the luteal phase and you're going to do more of a volume workout. So you're doing, example, 15 to 20 reps instead of 5 to 8, and you're doing more sets. So that would be a strength example along with the running.
I could definitely see how men are probably easier to study than the female athlete when you have all of these different factors to consider with how different hormone levels can affect their performance and also their recovery. And so you talked about progesterone for a little bit and how important that was. Could you explain more why progesterone is really important for our cycle?
So progesterone, the book Period Power is an amazing book. I recommend it for literally everyone. I'm going to have my daughter read it when it comes time. But they equate progesterone to Kristen Stewart. It slows you down a little bit. It's kind of that calm, I have never watched that movie. So, whereas estrogen would be Beyonce. That's not my analogy. That is in the book, where it's energetic and sexy and you're just kind of, because usually you'll have if you have a hormone imbalance, you're going to have, and it's not one hormone in and of itself. It's that hormone in relation to others because they're all checking and balancing each other out, right? And so typically people will have higher estrogen or lower progesterone.
So not that this was a podcast about pregnancy, but at the end of pregnancy, progesterone levels begin to drop, which progesterone is kind of relaxing the uterus and keeping it from contracting as estrogen levels begin to rise. So we're increasing those oxytocin receptors. And this is what's going to bring on a lot of those Braxton Hicks contractions and ultimately going to start uterine contractions for labor. And so progesterone is more of a relaxer. Estrogen is more of that contractor, more of that active type hormone. But again, they're working together. Nothing is working in isolation. Similar to how our pelvic floor doesn't work in isolation. None of our muscles work in isolation. Everything's working within this integrated unit. And so as we approach training with our cycle is acknowledging that there's multiple factors and that unfortunately there's not a set solution for everybody, but being aware of how different parts of our cycle may be affecting our ability to recover, how we're feeling during our workouts, and then coming back to that same acknowledgement of how am I feeling today and how can I meet my daily needs without expectations of what I should be doing or what I need to be doing. And this is going to allow us to just kind of honor the process a little bit more, and we're going to see better performance ultimately.
Talking about these hormones involved, so progesterone and estrogen, we know that some people are taking hormonal birth control that could be affecting their cycle or changing their cycle from that. Potentially they could have a 35-day cycle normally. Because they're on the birth control, it's going to be a 28-day cycle. But this is also synthetic hormones that they're taking in their body. So how would that affect their training abilities if they're taking these hormonal birth controls? And how would we adjust their training to that rather than their natural, non-hormonal contraceptive cycle?
If you are not taking any hormonal birth control, your follicular phase is your low hormone phase and your luteal phase is the high hormone phase. So that's basically switched when you are on a hormonal birth control, because what the birth control is doing is kind of like tricking your body that it's pregnant. So the hormones are a little bit higher for 3 weeks. And then when you have the sugar pill, things drop off. So to get like the most out of your training and taking advantage of the half-life of the hormonal birth control pill, you would take the pill 12 hours before you train. So you would take it at night if you train in the morning or vice versa, so that when the half-life of the pill and those hormones are starting to decline again before, you can kind of train when they're at the lowest peak. And then that sugar pill week at the end is when you can really just focus on the higher intensity and maximizing more intensity, higher weights. So it's a little bit different, but there are ways that you can kind of train around that.
So it sounds like there's still kind of this hormonal fluctuation, even if somebody's on hormonal birth control as well, but it's not going to be exactly the same as if you weren't on any sort of birth control. So as a pelvic floor physical therapist, do you notice any differences in your patients depending on where they're in their cycle? So what type of symptoms they're experiencing? Because I know for me, like I have different symptoms depending on where I am within my cycle. Do you see like they respond to treatment differently depending on where they're in their cycle? Does their pelvic floor just feel different depending on where they're in their cycle? Like, so what is your experience as a PT depending on where your patients are within their cycles?
So the biggest thing that I focus on with clients is having them track their cycle and symptoms. That is going to tell me, like, are they more symptomatic during ovulation, in the luteal phase, or during their period? But I found an article that showed 15% of women will have, symptomatic women will have symptoms during ovulation. And this includes middle schmerz. You know what middle schmerz is? It's a German word describing that, like, ovulation pain.
Oh, yeah.
Yeah, it's the follicle stretching or estrogen being high during ovulation. You have increased laxity in ligaments. So the urethral ligament could be more lax. So if people are having more leaking during ovulation, that could be why. Then we have 36% of symptomatic women. Actually, I'm going to go 42% because it's in line with the cycle. So late luteal phase, 42% had symptoms then. Late luteal phase is where you have an increased breath rate. So thinking about coordination of the core system, if your diaphragm, breathing mechanics are off, putting pressure on your pelvic floor, that could contribute to like prolapse symptoms. Your blood is more viscous, meaning it's a little thicker. So with pelvic congestion, you may have a little bit more heaviness in your pelvic floor as like the blood is not like going to and from the lower extremities as easily. So that can lead to heaviness and prolapse symptoms. Progesterone relaxes smooth muscles. So this is where you can have decreased urethral support and feeling kind of heavy more in the front. So people who have it literally like feels like your urethra is heavy. It's not like back in the pelvic floor. And then constipation, progesterone slows your bowels. So if you, I was reminded of this last week. I was like, I need to get my camera and make a reel because constipation is a real thing in the luteal phase. If you're constipated, then that pressurizes your core. So like the more bulk you have in your rectum, it's pushing forward, influencing the intra-abdominal pressure. But also, if you have to push more to get poop out, then you're also pressurizing. So prolapse symptoms can be influenced there. And then 36% of these polled people had symptoms during their period, which here you're having increased inflammation because inflammation is what helps start your period, and you have increased prostaglandins, which also increase your pain sensitivity. So you typically have more pain. And this is like a real thing. I just want to say,
they say not to get a like Brazilian or bikini wax around your cycle because you are more sensitive. And I thought that was just like a joke. That people are like, also just don't come and get your stuff when you're like bleeding from your vagina. But no, it's like actually true because I did get one during my period and I was like, that hurt a lot more than I remembered from 4 weeks ago because I had just started getting my period after Lily. And I was like, never again will I do that. So we're just going to prolong it for the next time so that I'm not in my period.
Yeah, my first session with my tattoo was in my follicular phase. That was planned. And I was like, easy breezy, whatever. This is fine. I go in the second time and I was like 5 days leading up to my period. And I swear I almost started equating it to birth, which is bad. It was so terrible. It was terrible. So it's a real thing. Pain sensitivity in the luteal phase is a real thing.
I must just live in a state of like chronic pain because I don't notice any differences during my cycle when I'm in pain. I'm just always in pain, I think. I don't really get bikini waxes or tattoos. I mean, I have a lot of tattoos. I haven't got one in a long time, though. But that's a really good idea to not only train with your cycle, tattoo with your cycle as well.
The best part is my tattoo artist was so on board and I was so excited.
And so at the beginning, you said there's not a lot of research to really support training with your cycle. But I also saw you say one time, like, if we wait for the research, we're all going to be in menopause, and we're going to be beyond this point. And so we don't always need a research study to tell us what we are observing in real time. It's just like there's not tons of studies on when you do this specific movement, this part of your pelvis opens, but we can observe it in people. We can observe it during labor, and we can kind of put two and two together without having like an official peer-reviewed article published. And so if you're waiting on the research to begin to implement changes in your workout to accommodate for your cycle and for your fluctuating hormone levels, it's going to be a really long time before you get that. Because one, we have to study women, which already is not a very popular thing to do for a multitude of reasons. Most research is geared towards men. A lot of healthcare is geared towards men. Like even the recommendations for what pregnant people should be taking are based on studies with men, which is humorous in a way. And so if you're waiting for the research study to tell you that this may be a good idea, it's going to be a really, really long time before that happens.
I just tell people, you're never going to regret knowing more about your body, right? And that's what this is all about. This isn't about like, oh, you only train here on this day and do this on this day. This is about tuning in to you and your patterns and tendencies in your menstrual cycle and being more connected and listening to your body. And I know like some people don't like that. Like, what does that mean? Well, it means like tuning in to how you feel and your energy levels and learning more about your tendencies and your menstrual cycle. Obviously, there's going to be differences here and there based on your life and stress and nutrition and if you're, what phase of life you're in and all of the other things. But the biggest thing is like just being more aware and giving yourself permission. Like if you're feeling like crap, you don't have to stick to that training program, right? You can tweak it. And like, it's not like a linear line, but more of like an ebb and flow. And you just kind of come in and out of intensities and you're going to feel better in your body when you do that instead of just grinding.
So I saw this one reel that was, I'm not training for my summer body, I'm training for my old lady body. And that really like resonated with me because I'm not a professional athlete. And I think the majority of people are not professional athletes. And so I'm not training for the CrossFit Games or the Olympics or any sort of professional athletic competition that my livelihood depends on. I'm training so that I can sit down on the floor and play with my kids and get up easily. I can carry my kids. I can do whatever it is that I want to do with my body. And then I'm training for my body however many years down the road so that my bones are dense, my muscles are dense. I'm not dealing with issues related to menopause or getting older because I'm training my body now for my old lady body because I want to have a strong old lady body too.
Yes, I totally agree with that. Amen.
So similar to prenatal workouts and those early first 6-month postpartum workouts, we want to be training our body in a way that honors what it's feeling each day. And so we don't have to, like Addie said, just grind because this is what my workout program told me to do. Because even during pregnancy, each day will kind of fluctuate with how you're feeling. Some days you may have tons of energy and then the next day we're at really low energy levels. And we really want to kind of honor what our body is telling us it needs each and every day. And learning to train with our cycle is just another opportunity for us to move beyond like the prenatal and that early postpartum fitness to a type of fitness that's going to help us continue to grow our body, to get stronger, and to prepare for that old lady body. So, Addie, do you have any last advice for folks that are looking to connect more with their body, connect more with their pelvic floor? Maybe they're still within that perinatal time frame, or maybe they're moving past it.
I would say start learning. I already gave a couple book recommendations. Period Power is amazing. And then Roar is more geared towards female athletes. For anyone who is in that menopause phase, Press Pause, Not Play is a really good one. There's a lot of female athlete information in that podcast. But learning and then kind of seeing what resonates with you, knowing that the body is not just muscles and bones. You have it's tons of systems working together, and just learning more about yourself is going to help you figure out what you need as far as just overall health. So finding a good health team, whether that be a pelvic floor PT or a functional medicine doctor or OBGYN that specializes in hormones. Cranial sacral therapy is one of my favorites for like visceral mobilization and just tension in the body. Like, just get your team and your resources, because it's not just about hormones, right? Like, it's about your whole body. Hormones are reflecting kind of what's going on in your whole body.
So where can our listeners learn more from you?
I have a Facebook and I'm more on Instagram. I do have a Facebook page, New Me Physio, but my Instagram at Addie Holzmann. I try to post a lot of information. I've been kind of like slow lately. I do have a podcast that's been slow. Me and my pelvic floor PT friend Haley Kava have a podcast, Don't Beat Around the Bush. We have a couple episodes on cycle training and just all kinds of information. If you want to know way too much about our pelvic floor health, you can check that out. I have some online courses for postpartum recovery and just blending PT with your workouts, because that's how I teach clients to work out so that they leave their workouts feeling better instead of with joint pain or pelvic floor issues.
Definitely a big part of pelvic floor physical therapy and just PT in general is not just the rehab work, but how can we integrate that to help you return to your fitness? And Addie's somebody who's really awesome that does that for you. So if you're local to us, you can work with Addie in person as a physical therapist. She has a new office now in downtown Southern Pines. And if you are not local to us and you want to connect with her, she does do virtual support as well. So thank you for listening to the MamasteFit podcast. Hopefully you learned a lot of information on how you can adjust your workout intensity to accommodate to where you are within your cycle. And there's a lot of different things that we can do to kind of figure out where we are within our cycle. We talk a lot more about the fertility cycle in episode 25 with Sophia, who's a fertility nutritionist. And so she talks a lot about the different hormones that are involved within it. You can check out our blog where I'm sharing all about how I am adjusting my workouts to accommodate for my cycle as I'm preparing for my conception journey.
So thank you for joining us today and listening to this episode. If you want more support throughout your pregnancy, join our prenatal fitness programs and childbirth education course. If you need more support after birth, join our postpartum fitness programs and education courses. If you're a professional, we offer birth worker and fitness trainer courses so you can learn from us and earn CEUs. And you can explore all of our courses on our website at MamasteFit.com, and you can use code STORY10 to save 10% off all of our programs. If you enjoy this episode, please follow our podcast to be notified when we release new episodes, leave a review, and share with your friends, family, anybody you meet on the street. Tell everyone you know. We release new episodes every Wednesday and new birth stories every Friday. This podcast is sponsored by Needed, a nutrition company focused on optimal nourishment for your perinatal journey. You can use code MamastePod for 20% off your first Needed order.